I'm going to kind of give you an overview of why the Affordable Health Care Act is so important for each and every one of us. But before I do so, I'll kind of set the stage. We haven't done much since we passed the Affordable Health Care Act 3 years ago. What we have done in Congress is voted 40 times, not once, not twice, but 40 times to repeal the Affordable Health Care Act. Now, why would we want to spend time repealing something after it has been passed? It has been found to be constitutional by the Supreme Court. But truly, that is what we spend our time doing, rather than creating new jobs in this country, rebuilding our infrastructure, passing a budget, fixing postal service so it will survive into the next 50 years, and replacing the sequester. Why wouldn't we be doing those things? But no, we're trying to repeal the Affordable Health Care Act. Well, I'm not part of that. We have done a few other things. Let me point out that we did manage to pass the Freedom to Fish Act. The Freedom to Fish Act allows boating access around dams in Tennessee and Kentucky. It's really important in the big scheme of things, isn't it? And then also to specify the size of the precious metal blanks that we use in National Hall of Fame commemorative coins. So, if you see that I'm a bit annoyed by what's happening in Congress, it's real. But to get on to the Affordable Health Care Act, there has never been a program created in this country that has massive appeal and massive protection that hasn't been the focus of criticism. So you learn to live with it. But just to kind of put this in perspective, Ronald Reagan said in 1961, if we pass Medicare, Medicare was passed in 1965, so in 1961, Ronald Reagan said, if we pass Medicare, we will be telling our children and our children's children what it was like to once be free in America. George H.W. Bush described Medicare in 1964, again, a year before it was passed, as socialized medicine. Bob Dole in 1996 made the point when he was running for president that I was there, fighting the fight, voting against Medicare, because we knew it wouldn't work. Okay, so Medicare has some issues, but Medicare has been there for the senior citizens in our community and for those who are disabled in our community for decades now, and has meant the difference between life and death. Now, fast forward to the Affordable Health Care Act, and where are we? Well, we are at the cusp of doing some pretty remarkable things. But we've already done some pretty remarkable things with the implementation of the Affordable Care Act, and that's important to point out. Healthcare is a complex issue. There's no question about it. But it is important that we take the bull by the horns and fix this broken system for two reasons. One, because the Medicare costs were skyrocketing out of control. And we had to create some savings within Medicare and to bring down our debt. And secondly, because there are 47 million Americans who are walking around today without health insurance. And it's not because they don't want health insurance. It's not because they aren't working. It's because they, one, either can't afford it, even though they are working, or two, they have a pre-existing health care condition that excludes them from accessing health care. So we'll get into that in just a moment. But in 2010, spending in Medicare and Medicaid now represents 23% of the federal budget. That's 3% more than what we spend on the defense budget. So we had to do something to rein in the costs of Medicare. Now, put this in perspective. We spend 18% of our gross domestic product on healthcare costs. In California, we spend 12%. If you took the next 10 biggest developed countries in the world, add up all the money they spend on healthcare, it would still be less than what we spend on healthcare in this country. because so much of our healthcare ends up coming at the highest cost when people become chronically ill, run to the emergency room, and then are getting life-saving assistance. So, on top of having the most expensive system in the world and spending so much more than all these other developed countries, we also have the worst outcomes. Now that's something that most people don't really get their arms around, because we like to think we're the best and the greatest. That's just our nature as Americans. But the truth is, in terms of healthcare, it's not the case. We actually have outcomes that are not as good as many of the other countries. We spend the most. We're number one in spending. We're 38, based on the World Health Organization's World Health Report in 2000. So, reason for us to pause and evaluate whether we could do this better. What we have typically done is reward volume, not quality. And so when you go to the doctor and all of a sudden you're getting lots of services, you think, oh, I'm getting really good health care. You're not necessarily getting really good health care. You're getting lots of services that may or may not be appropriate. One of the bills I'm carrying is to deal with the physicians who have what are called ancillary medical services. They own the MRI, the CAT scanner, the laboratory, and all of a sudden you're getting more and more of these tasks. It's not necessarily because it's good for you, but they make money because they own it, and so they have to use it, and they pick up their, make the money they make by the volume. And as small business owners, you should also know that you end up paying, to the extent that you are offering health insurance to your employees, you're paying a higher premium than larger businesses. And the question is that fair? No, it's not fair. And that's one of the things that will change with the Affordable Care Act. The businesses with 1 to 9 workers pay 18% higher health insurance premium than those paid by larger companies. I'm going to share with you a story. This is a real story. I do telephone town halls, as you know. How many of you listen to my telephone town halls? A few of you. All right. Go onto my website. You can click on and ask to always be included in the telephone town halls. And if you're home, you can listen in for as long as you want. We normally do them for an hour. We do them every month. And we talk about the issues of the day. But recently on a telephone town hall, I had a businessman, small business owner from San Bruno. His name is Dan Strazulu, who runs Peninsula Seafood Market. He's a small businessman with 20 employees. He was complaining about the fact that he used to offer health insurance and pay 100% of the premium for his employees, but it got more and more expensive, so now he's only contributing 50% of the cost of the health insurance, and he doesn't feel great about it. His total premium is, for a family of 4, is $2,500 a month. The average salary of his employees is under $50,000 a year. Now, one of his employees needs surgery, but that employee is holding off getting the surgery because he can't pay the copay. Now, is that the way it should be in this country? Absolutely not. So, the math doesn't work for Dan or his employees because he has no bargaining power. And what the Affordable Health Care Act does is create a situation where you have bargaining power. Now, I'm sure many of you have stories like that. So what does the Affordable Care Act do for you is the question. First, it's important to make clear that the employer requirement to provide health insurance does not kick in unless you have 50 employees or more. So if you have less than 50 employees, you are required to do 0. 0. Doesn't mean your employees don't have a requirement to access health insurance, but you do not have a requirement to do anything. If you have 25 employees or fewer, there is a great benefit for you if you provide health insurance to those employees, and if they make, on average, less than 50, or is it 35? $50,000 a year, you're going to get a tax credit. You're going to get a tax credit that may be anywhere from 35 to 50%. So that's money literally in your pocket. Now, those are the incentives that are provided for you to actually offer health insurance to your employees. But again, if you have less than 50 employees, you are not required to do anything. But to receive that small business tax credit, you have to have fewer than 25 full-time equivalent employees. You pay an average annual wage below $50,000 per year, so you add up all the wages of your employees, and if it averages less than $50,000 a year, then you are eligible, and you contribute at least 50% of each employee's premium. So in Dan's case, Dan already qualifies for a tax credit, and he didn't even know it. But the scenario I gave you, he already is eligible for a tax credit. Now, one of the other complaints that Dan had was that he's not been able to pool his risk. You're a small business person, it's very hard to do that. Well, with the Affordable Health Care Act now, you're going to be able to, because beginning in 2014, small businesses like Dan's will be able to offer their employees a range of plan options through the multiple insurance companies in the small employer segment of the marketplace. Now, this is called SHOP. You're going to be hearing a lot about SHOP from our two experts here. But that's what's going to give you the buying power and going to give you the ability to look at a lot of different plans to offer to your employees. SHOP is going to help level the playing field for small employers by allowing them to pool their risks together with other small businesses. So in Dan's case, he's going to benefit from that as well. It also requires that all of these insurance companies standardize their information so you can compare apples to apples. So you can still use your insurance agent, or you can choose not to, because there's a standardization there that's going to allow you to compare and contrast on your own. There are going to be 4 health providers offering SHOP plans in San Mateo County. We already know this. Kaiser, HealthNet, Blue Shield, and the Chinese Community Health Plan. Now, the other great thing that happens as a result of plans like SHOP and in the individual exchanges, and this is really important, and people I don't think always understand this, the maximum annual out-of-pocket limits for an individual now will be $6,350 a year, and for a family, $12,500. Now, what does that mean? That means $527 a month will be the maximum cost of your out-of-pocket for your premium and your drugs. Now, you talk to anyone who's a chronic condition, high risk, they're paying $700 or $800 for a plan that typically has a high deductible, catastrophic, and it doesn't cover drugs. So this is a huge benefit for everyone. There's also improved protections in the ACA for consumers generally. And we saw it here in California. One of the things that would happen is called rescission. So you have health insurance, everything's great, all of a sudden you get really sick, you go into the hospital, and then the insurance company looks over your application and finds out that something wasn't accurate, and they yank your insurance while you're on the operating table. It was actually going on in California, and we drew attention to it, and the Affordable Care Act then prohibits now that kind of rescission. The other interesting thing that has always hurt people who are over, well, actually of any age, but as you grow older, you have what are called pre-existing conditions. How many of you think you have a pre-existing condition? Well, most of you should be raising your hands, because virtually everyone has a pre-existing condition. Because it's anything. It's a bunion.
I'm a case of that.
Okay.
I'm down because of bunion.
All right.
If
If you once went to the doctor and said, I have headaches, and they wrote that down, that's a pre-existing condition. In one case, a woman had breast cancer, needed surgery, and she was in the individual market, They then looked at her record and said, oh, you have a pre-existing condition. You had acne in high school. Seriously, that actually happened. So these are the kinds of things that we've already wiped out of the system as it relates to rescission, as it relates to pre-existing conditions for children. And starting in 2014, no one can deny you health insurance as an adult if you have a pre-existing condition. Huge, huge win for all of us. And for those of us who have young adult children, you can persuade them that if they take out the garbage, you will keep them on your health insurance plan. Up to the age of 26, you can keep your young adult on your health insurance plan. You don't have to, but you are allowed to. And there have been, I don't know, millions of young people who have benefited now from being able to stay on their parents' health plans. There is no longer a lifetime limit on your health coverage. I had one employee who had esophageal cancer. And all of a sudden, by the time she had gone through all of her surgeries and chemotherapy and radiation, she was bumping up against her $1 million cap, lifetime cap on health insurance coverage. No longer is there going to be that lifetime cap. No longer will there be an annual cap as well. As insurers are not going to be allowed to have waiting periods. And they must meet certain rating requirements. It also closes the donut hole for those who are on Medicare as it relates to prescription drugs. And right now, for those that exceed the $2,300 a year in actual prescription drugs, they then start having to pay out of pocket to about $4,000. We're shrinking that particular donut hole between $2,500 and $4,000 so that by the year 2017, I believe it is, there will no longer be a donut hole. The other thing that's important to point out, who are the uninsured? The uninsured include 36% of those making less than $25,000 a year. And most of these people, half of the uninsured in California, are actually employed full-time. So these aren't people just kind of sitting on the sidelines. They're people who are actively involved working full-time. The employer mandate does not apply to small businesses, but as I pointed out earlier, while you don't have a responsibility, the persons who work for you are subject to the individual mandate. And what happens here? So, in the individual mandate, there are subsidies for persons who are low income. So anyone who makes under 400% of the federal poverty level, and that means $45,960 for an individual, or $94,000 for a family of 4, that puts them under the 400% of poverty. And in that case, they are eligible for subsidies. In 2011, 68% of Californians earned less than 400% of the federal poverty level. So that's a lot of people. And for the first time, all individuals under 138% of the federal poverty level will be eligible for Medi-Cal, including single adults. So, what we have seen already in California is that competition is having a very salutary effect. Prices for health insurance are down anywhere from 2% to 28% in the individual market. There are some states where it's down 50%, 70%. I mean, it's really pretty remarkable. New York has actually seen a 50% reduction in their premiums that are being posted for next year. And the small businesses in California, last year, $36 million rebated in checks to small businesses. Why? Because there's a requirement now that 80% of the premium be spent on healthcare. Restricts the amount of money that can be spent on administrative costs. So if there's money left over in that 80% at the end of the year, rebates to the small businesses, rebates to the individuals. So we're lucky here in California because we're way ahead of the game as compared to other states. And you're going to be hearing a lot more about Covered California. Let me also point out, every member of Congress is now going to be in the exchange. We don't get any special deal. In fact, we're not even eligible for the federal employee group health insurance plan anymore. Every member of Congress and their staff members will be in this exchange. The overall effect of these changes is to reduce the cost of coverage for those least able to pay. The most recent study by Covered California indicates that families earning less than $60,000 a year could save up to 84% on premiums and 76% on all costs associated with Medicaid. So I hope I'm giving you a pep talk about how great it is, not just the act, but the benefits to each of us as consumers. And I think most of you know that I've been a huge consumer advocate my entire legislative career. And this is going to create accountability for the insurance companies. It's going to prevent them from doing the kinds of activities that they were engaging in, like rescission and discrediting claimants when they would file for their health insurance. But let me just talk a little bit about one other issue. It's the lack of transparency in medical billing. And it's been created by the insurance industry and by Medicare. Everyone thinks that Medicare is like a blank check. My mother was one of those people. She was 92 years old. She was in Peninsula Hospital. She had congestive heart failure. She had had a great life. She was teaching adult education upholstery in the San Mateo Adult School program into her 92nd year. And the cardiologist comes up to me and says, we think we should do angioplasty. And she's 92 years old. I know what the stats are. I say to him, I think that we should just allow her to live out the rest of her life comfortably. He says, well, I was kind of shocked. He said, well, let's ask her. You ask my mom, as long as it's not costing her anything, sure, do whatever you can. Because she was immortal in her mind. So what we do need is transparency so that each of us can look to see how much do these services really cost and how much do each of these hospitals actually charge for it. Let me give an example. The Medicare data shows a joint replacement surgery at one hospital cost $5,300. Another hospital charged $223,000. Inpatient services for heart failure were $9,000 in one hospital and $51,000 in another. One patient was billed $18 for a single diabetes test strip, and another hospital charged $77 for a box of gauze. Now, how do we make these hospitals more accountable? It's by putting a bright spotlight on what's called the charge master. And Secretary Sebelius in May of this year required hospitals across the United States to actually show the American people what 100 of the most common inpatient services would cost at their specific hospitals. So you have a right to know, and you should go and access that page to see how much they are charging. And that's going to have a huge effect as consumers to bring the cost down. Just exposing it on the internet is going to cause many of these companies, these insurance companies, and these hospitals for bringing down the cost. That is going to be good news for all of us in terms of our premiums, in terms of Medicare, in terms of the federal budget. So let me close, if I could, with a couple of points. From 1998 to 2010, the healthcare industry, including doctors, hospitals, pharmaceutical companies, insurance companies, and nursing homes, spent $5.3 billion lobbying Congress. Now, when we think of big-time lobbyists in Washington, what comes to mind? Defense contractors, right? Well, they only spent $1.5 billion on lobbying. And the oil and gas industry only spent $1.3 billion on lobbying. So the biggest lobbying entity in this country was the healthcare industry at $5.3 billion over that time frame. So we know what happens when lobbying money comes into play. It benefits that industry over the interests of the rest of us. So it's really important for us now to embrace the Affordable Health Care Act, recognizing how much it really offers us already and how much it will offer us in the future. And be reminded of what was said by those former great leaders who are maybe not as far-sighted. Ronald Reagan, Robert Dole, who wanted to just absolutely squash Medicare before it came into being. And we all have stories about how Medicare has saved family members' lives and how important it has been for the older Americans as they have aged to have that kind of service. And if the rest of the world has figured this out, a country like ours certainly can figure this out as well. So I'm delighted that you're all here. I'm delighted to be in beautiful Pacific again. Thank you for the opportunity to speak this afternoon.